now we are live. So,
All right.
Gordon Wallis, nice to meet you.
Right. Yeah, nice to
Um,
meet you.
and it's a pleasure to have you on. I know we've been going back and forth on LinkedIn for a while. On LinkedIn, where you have a pretty substantial following of practitioners that seem to come to you for a to your content from a very
It,
specific reason.
they read a lot of my posts,
This,
is what
okay,
they
so
do.
I
Yeah,
see. And so
excuse me.
and you receive commentary from both sides of the fences
Oh,
to
yeah.
your
I receive a lot of good comments and things, but I get a lot of negative comments too,
and,
quite a
and,
lot.
and so that's almost like a disclaimer that I would like to input now in the beginning of
Uh-huh.
this. And it's something I think you said to me, so I'll let you expand on this little disclaimer without being apologetic in any way. But just to
Yeah.
anyone that's listening to this, any practitioner that's listening to this, the purpose of this is really to just uncover and dig through these different concepts and thoughts. And the idea here is right is not to step on anyone or not to overexpose anyone, or we're just here to share your perspective and your ideas and your thoughts and
Yeah.
the perspective of someone who's been practicing, teaching, and healing for
Well, I
many
mean,
years.
the weird thing is that what I'm doing has been around for like over 2,000 years. So and I didn't just like pull it out of the air. It didn't just come to me like in some sort of vision deal. I mean, I learned from other people. It's just that it somehow has remained suppressed. I don't know why, it's
So let's start
I
with that.
almost
So
want to say conspiracy theory thing, but
yeah.
I don't know because
So what
this,
is it? So what is it that you practice, and what is it that has been uncovered
it,
for the last 2,000 years?
it's a way to eliminate myofascial pain like instantly, as fast as flipping a light switch. And see, I say that it sounds weird. Now, if I would have heard somebody say that 15 years ago to me, I would have thought they were crazy and just, you know, screw that. And that's how they're reacting. And then they
Is-
see my videos when they actually see that happening, it looks fake.
So
But I demonstrated it.
is it at the speed of a light switch?
Yeah, it is.
So
It's instant.
can we
Well, I mean, sometimes it takes a couple seconds or something, but it's like, and sometimes you have to do it. How should I say? I have to explain how it works a little bit. It's a meridian-based system, and it eliminates myofascial trigger points. Those are the two things.
so
That's what it is. But people don't know what meridians are, and people don't know what trigger points are. So that's part of the problem right there. Once you
okay.
understand what meridians are and what trigger points are, then this starts making more sense.
So can we start with meridians? Now,
Well, meridian,
but when you say but so before you explain,
yeah,
so when you say that
okay,
people don't know what they are, is it
right.
generally speaking just people aren't aware of what meridians are, or are people learning meridians in a potentially inaccurate way?
Both. I mean, they're both. The, you know, there, there's this. If you're an acupuncturist, follow the TCM people. See, I get hate from those guys too. There's no such thing as an invisible vessel that transports a mysterious energy that nobody knows through the body. I mean, come on. What I'm doing is real physiology. Uh, Meridians are actually muscle chains, myofascial muscle chains, real similar to like exactly what Tom Myers discovered whenever that was in 1990s or whenever he came out, or 80s or
The
whenever he came
anatomy
out with
trains.
that. That yeah, the anatomy. I mean, the ancient Chinese dissected people a long time ago. Man, they had like prisoners and they tortured them, took them apart, and they saw these myofascial chains. Uh, that's what they are. And it even says that in a lot of the ancient texts that the meridians were discovered through dissection. Dissection. So how do you discover invisible vessels through dissection? No, they're real, and the energy, the ki, the original meaning for ki is like vapor or air. The lungs are the source of all ki in the body. That's air. It's oxygen. They're talking about oxygenated blood flowing through the body. You have good ki. If you're unhealthy, there's no circulation. Yeah, they're myofascial muscle chains.
Okay.
And
And so,
that's what they are. They're
yeah.
bands of muscle chains. They're not just lines on the body or invisible vessels and all that kind of stuff.
So what
It's
is
real
it? Why?
physiology.
But why is this void? Like in your perspective, why is there a void of like you said, the two things that people don't know
Well,
what they?
if you take a course, massage therapist, I've taken like 3 or 4 continuing education courses in acupressure. They talk about energy, chi and energy lines, and that they're not a real physical structure. They actually say they're not real physical structures. So it's this, and that turns people off. All the educated scientists, PhD people, they hear that and they go, what a bunch of bullshit, and they won't even look at it any further. And even the traditional Chinese medicine schools, they teach it as energy, as in some sort of. They don't teach it like a real physiology as to what it is.
So what's the physiological standpoint or
Well,
perspective from
they're
from how you from how you see it?
they're myofascial muscle chains. It's like I said, you've got and you move. If I bend forward the meridians, I'm just call them meridians. It's a synonym for muscle chain. If I bend forward, the front muscle chains are contracting. The back muscle chains are relaxing. So they function as long, giant muscles. Not instead of 700 individual muscles, there's 12 major muscle chains, and that controls all movement of the body. Like if I go like this, the side chain is contracting. I look at it as one muscle, and it functions as one muscle, even though it's probably 300 muscles. See? And
So,
so,
but are you saying that it's the way that the meridians are taught, for example, in acupuncture schools, is it being
oh yeah,
diluted by adding the energy force
yeah,
behind it?
it's
Is it?
energy. They're teaching energy. You watch them. You go watch them, and they're going like this, and they're channeling the energy and all that kind of shit. It's not going to do it. It's like, come
But
on,
what did you
man.
think do you think it's but is the core of what they're teaching accurate if you subtracted the energy component from it?
Well, they see TCM was invented in 1949. Okay,
Mm-hmm.
so it's kind of like the Bible. They all came together to whatever that group of people was, and they threw out certain books. Well, the Chinese medicine's huge. They have the herbalists, they had the acupuncturists, they had the qigong people, all that kind of stuff. Well, the herbalists took over, so everything went into an herbal diagnosis, and people don't realize that acupuncture. I don't know all the dates. I just remember reading this stuff and go, okay, it's all bullshit. There's that, like the energy model is just from misinterpretation, mistranslation from a European guy. He didn't know how to, translate properly. And then at one point, like I think it was when Mao Zedong took over or something, he actually banned acupuncture. I might be wrong on this, but they banned it for a while, and because they wanted to get into the more Western, uh, modernize and get into the Western
Yeah.
approach. And so when they all that just over, have you played that in grade school? This game where the teacher whispers into the ear. of one student, and you're supposed to repeat the exact
Like
same thing to the student next to you.
the broken telephone. Yeah.
Yeah, broken telephone. And by the time it gets to the last person, it's completely different. It has nothing to do with the original statement. Well, that's kind of what's happened. It was a real physiology. I
So
mean,
yeah.
yeah, it's a real physiology. And what I do is based on that physiology. And there's rules. The acupuncture that they don't teach in traditional Chinese medicine school is what I re-engineered to my hands-on therapy. It's a balance method acupuncture, I Ching acupuncture. What else do they call it? Meridian-based acupuncture. They don't teach it in TCM school. So, they teach this weird energy stuff.
So
And
from
I
your
worked with
yeah.
acupuncturists. I work with acupuncture. I'm like 70 years old. I worked with them when I was in my 20s. And I saw people coming in. I never saw anybody get well like instantly and stuff like what these other acupuncturists are doing and what I'm doing.
So
It's an
that's the
instant
meridians.
result.
So, but yeah, so maybe like to again just to cap this little maybe maybe difference in terms of how it's taught in certain institutions versus how you see it or how
Right,
you practice. So
right.
so for the purpose of this, what is your foundation when it comes to meridians? But so is it just that removal of the energy component to it, and just looking at it
Oh,
physiologically for
okay.
what
Well,
it is?
yeah, they're myofascial muscle chains, okay? And a muscle chain is simply a group of muscles that function as one muscle. And what I'm doing is manipulating muscle chains. Like there's a thing called reciprocal inhibition. Like when the bicep gets tight, the tricep gets loose. Okay, so well, this happens on a huge scale.
Yeah.
When the front chain, when the front meridian, or whatever you want to call it, when the front muscle chain gets tight, the back muscle chain gets loose. And it's the interaction of these muscle chains. So if somebody is sore right here, and I determine that that is on one of the arm muscle chains, when it's on the front right arm muscle chain, I know what muscle chain to stimulate to make the brain think, wow, I got to relax this muscle chain.
And that's
So
the
I'm injecting a mechanical force into the body, and the body has to respond. And that's.
Okay, so let's introduce the trigger
So
points part into there. So the trigger
right,
points
yeah,
are points on the muscle chains.
yeah. Yeah, I just determine it. It's so simple. I determine what meridian or muscle chain. I'm just gonna call them meridians because
Yep, yep.
I determine what meridian the trigger point is on. And then from there, I have like a dozen different choices on what other muscle chains will affect that meridian. And that's. I mean, when you press, I don't, now when they teach acupressure or something, they just press like this and they meditate their chi going in. It's not going to do anything. When I press, I'm pressing and I'm twisting. I'm distorting the tissues. And the brain picks this information up, and it will make adjustments. And it'll loosen up the top. I can loosen and relax any muscle in the human body I want instantly. And it takes the pain, the tension, the trigger point out with it.
So talk to me now about the trigger points, the definition of a trigger point, and also the disparity
Oh, yeah.
between how it's taught, and also like the difference between a trigger point and an acupoint, if there is.
Well, the acupoints don't mean anything to me at all. They're just landmarks, or I just use them for location purposes if I want to describe where the trigger point. A trigger point to me is just a painful palpatory area on the body. But see, the other thing, people don't know what trigger points are. And it just blows my mind. They don't know what trigger points are. Even the trigger point experts don't know. But if you read a book on how muscle functions, you easily know what a trigger point is.
So what are the
Like
trigger
your
point
brain,
experts? Yeah, but
you,
what are the trigger point experts getting wrong?
well, they don't know what it is. I mean, when they describe it, what have they just, you've talked to trigger point people, I'm sure, haven't you?
Yeah, and I've
Do,
heard,
do they tell you what a trigger point is?
I have,
It's, they, it's,
yeah.
it's very vague, but they don't tell you that it's a damaged sarcoplasmic reticulum in the muscle cell. Do they ever heard that?
Can
It's
you
like,
repeat it again?
well, okay. It's a damaged sarcoplasmic reticulum in the muscle cell.
Sarcoplastic reticulum.
Sarcoplasmic reticulum, it's an organelle in the muscle cell that controls calcium flow. Okay, so when your brain sends a signal to the muscle cell to contract, that sarcoplasmic reticulum exudes calcium from its membrane, calcium ions or something like that. That calcium mixes with a bunch of other stuff in the cell. There's a chain reaction, and the muscle cell or fiber, they call them fibers, will contract. Okay. Then when there's an electrical signal from your brain to the muscle cell to relax or lengthen, the sarcoplasmic reticulum reabsorbs the calcium, separating it from the myosin and other stuff that's in the cell. Then the muscle fiber relaxes. It's a structure. Now, if that structure breaks,
Yeah,
like stress, repetitive movement over and over again, one position too long, emotional stress, you're going through a divorce, you're all angry or whatever, or a blow from an accident, it can break like any structure. And when that breaks, the calcium ions just leak out, mix with the other stuff in the cell. So any muscle cells or fibers that run through that area will then contract. So then you have an area of contracted muscle fibers, muscle cells within a relaxed muscle, and that's your trigger point. All right, it's damaged. It's damaged muscle tissue on a cellular level. That's exactly what it is. And the old school way of doing it is you find the trigger point, and of course it's going to hurt because it's damaged tissue on a cellular level. So they press on it, and if you do it perfectly, you press out the calcium mixture back into the venous system, out of the area. Well, then the fibers will open up and lengthen. Okay, and that's how the old traditional trigger digital pressure trigger point stuff works. And the dry needlers, they're sticking a needle in there, and it's like a sliver. The body or the brain sees that as an invasion. It rushes a bunch of blood there. It cleans out that calcium mixture, and the trigger point goes away. That's if you do everything perfect. But you're stabbing you're stabbing damaged tissue, or you're smashing damaged tissue. It's not very
yeah,
efficient. The
yeah.
way I do it, I'm not damaging the tissue. The muscles just relaxed without any damage at all. So the healing is rapid. Uh, yeah, there's no digging on damaged tissue with this method, and or any of actually those acupuncture methods too, because you never work on the area of damaged tissue. So it's far superior and faster, and it's immediate.
But
One muscle get
you are applying pressure.
no, I'm not. I'm just touching, directing the nervous system to the area. You
Mm.
just touch it. So yeah, that's the right spot, and then you touch them somewhere else, and they'll go, oh yeah, it's gone now. And it just directs the nervous system to that area. It's faster. Now you don't even have to touch. You know, you don't even have to touch the area. You can still release the trigger points that way. But it's just faster if you do touch because it just is.
How did you how did you get exposed to things in this way? What's been like the involvement of your career? Because where did you? Because
Well, I mean,
you studied massage
I
therapy in the United States.
right. Yeah, I studied well, okay, how do I say? I started out in Hawaii on Maui, and I became a shiatsu therapist, which is a Japanese style of massage. So I'm already into the Asian thing. And I was at that point in time, I was kind of athletic, martial arts, doing all this kind of stuff. I was into self massage and stretching and doing that. And massaging the sore spots and all that kind of stuff. And so I knew if you got rid of sore spots, uh, that's one thing. And shiatsu was this Japanese style massage, and there's meridian based shiatsus and all this kind of stuff. So I was aware of it, but I always thought that I was more on the physical side of things. I didn't think too much about meridians or anything. Then I got hired to work with an acupuncturist, and I got more exposed to acupuncture there. This is like 35 years ago.
Yeah.
So I was, I've always been connected to the Asian side of things, but I didn't never fell into the energy, model of things. I just knew if you press and work on body parts, that that's helpful, So, but I was working on one person and I helped him quite a bit, and they told me, my friend went to this acupuncturist in another state, and he had pain for like 10 years, and this guy stuck needles in his feet and the pain just disappeared. And I heard that and I'm going, oh, whatever, So I heard it a second time from another person that they went to this, and it's not the regular acupuncture that they teach in school. And I'm going, And about what year? Maybe 2010. I started looking at acupuncture books, and there's one Acupuncture 1, 2, 3 or something like that by Dr. Tan. And I got it, and it was, he basically said the acupuncture that they teach doesn't work. He didn't say those exact words, but after reading it, it doesn't work. This works. So I started looking at it and went from there. This balance method, you can look up balance method acupuncture. You can see videos on YouTube. They're sticking the needles in people's feet and they go, oh God, my back doesn't hurt anymore. So instead of using needles, I use my hands. I use my fingers. And there's advantages and disadvantages to that.
So what are the advantages and disadvantages?
Well, the advantage is you're actually touching somebody. You're not sticking a bunch of needles in them and then leaving them for 10 minutes or something, So you're actually touching them.
Yeah.
So I mean, the human touch is powerful. So that, and and they're treating, I'm a massage therapist. I'm just treating pain. Okay. These people, acupuncturists are treating all kinds of stuff, irritable bowel syndrome. I mean, all kinds of different internal diseases. My license doesn't allow me to do that, although this information works on all that kind of stuff. But, I mean, I know what I'm saying. It sounds crazy.
No, I'm just, yeah.
I can't explain this stuff easily, but
yeah.
It's so simple. It is so simple.
Because you keep saying, you keep saying the simple part. So you think generally speaking, are we overcomplicating the meridians and relationship?
People overcomplicate everything, so much. And it is so simple. Like even finding a trigger point is a big deal for people. And then people send me studies that show me experts can't find trigger points and stuff. So I'm kind of, but the study is flawed to start with. Like they have somebody who's in pain. They have them laying on a table. They don't talk. And the expert's supposed to feel the cellular damage beneath the skin. That people say they can do that, and it wouldn't surprise me if somebody can, but in general, you cannot feel cellular damage that's 1/2 an inch below the skin. But if you I find them easy. I just go, you tell me when I get to a bad spot, and I go like this. I go, oh yeah, that's bad. I go right there. They go, yeah. Okay, so I go, well, that's on the triple burner meridian. So I know it's on the middle arm meridian. There's 3 of them on the outside. So it's on the outside group of meridians. It's in the middle. So if I go to the opposite side of the body, go to the leg and stimulate the middle outside meridian on the leg, it's going to relax this one. And it does. and it takes the pain out, and that's it. It's gone. I mean, it's just so simple, and I have a lot of options.
Yeah.
I've got like many options,
So it's
and it's
so as long as,
really
because
simple.
I've seen you, like you said a few times that like it's
Hmm.
something you can teach your neighbor.
I can teach
Like,
the neighbor lady how to do
the
it.
neighbor lady is
You know,
the term
I
you
have a
use.
hard time teaching. I have a hard time teaching people with PhDs because they go. See, the problem is it is so different, and it's so easy. It's like, they go to school for years and years and years and years. I wouldn't even be capable of getting a PhD. I mean, I couldn't do it. So when I say they go, that's it, and I go, yeah, that's it, and they just have a hard time. I mean, like finding a trigger point. They go, well, how do you? Can you the top band, and what about the twitch? I don't care about that. I don't. Just tell me when I get to a bad spot, and the patient will flinch, or they'll go, yeah, right there. I said that's it right there. They'll go, yeah, I found the trigger point. And they never teach finding trigger points. I find them with the palm of my hand. They always teach you have to know the frickin' a muscle, the particular muscle and the muscle fibers, and you got to feel them, and you have somehow. I don't even need to know what muscle I'm working on. I don't care I don't know what muscle I have to think about it. It's a deltoid, I guess. Maybe it's one of the pec muscles. Who cares? It's right here. It's on the lung meridian. It's on the lung muscle. If you want to look at it, it's on the lung muscle. So how do I relax the lung muscle? Well, the large intestine muscle over here will relax it. The bladder muscle chain on the opposite leg will relax it.
So
There's a whole bunch of different. So
for the neighbor lady,
yeah.
and for the neighbor lady is so then
Well, you have to know the meridians.
so as if the neighbor lady knows the meridians and the
She can do it.
relationships between the meridians,
Yeah.
but it's something that also one can self-apply. Like if I know,
Yeah, it doesn't really work on. You can't really do it. It doesn't work that way. I've tried it. At least on.
like tickling yourself.
Yeah, it's like tickling yourself. It somehow doesn't work. I haven't figured out why, but on other people it works.
So, but what? Yeah. So, why do you think is that though? Is it because of the to stimulate your own nervous system? You need something external.
Well, I think because if I'm over here touching the trigger point, yeah, that's it right there. The muscle chains are moving. When I'm working on somebody, they're sitting, they're not moving, and I input a distortion into one of the chains, then there's a response. But if I don't know, there's something about actually doing it yourself that changes that. I mean, I just know it doesn't work.
And with
I don't know why.
Have you used or tested? I know any tools, any trigger point assistive tools that can help. Maybe focalize the the area that you're working on.
No, because you still have to touch. You still have to touch it and then touch. Where can I touch? You're too contracted and tightened up to make it work. That's my only. I mean, I don't know why it just doesn't work.
Yeah.
I've tried it, but when I'm working on somebody else, it works.
Yeah,
it works, And my number one guarantee is this doesn't work on everybody, but it works on most people. And if people knew how effective this is, they would not be doing anything else.
Okay.
They would not be doing anything else at all.
But now, so speaking now, you're speaking at helping people with pain at the speed of a light switch. Now, but is that something that is because it's so fast tracked? Is it something maybe less long term of a solution? Is it more likely to the pain more likely to come back because it goes away so quickly?
Well, it all depends on the nature of the injury. It's way more effective than any other trigger point therapy out there by like light years. All that other stuff is obsolete. But somebody might, like, for instance, what other trigger point therapy is going to eliminate 36 trigger points, 46 or 56 trigger points on somebody? They're not. They're not going to do it. This one will. So somebody comes in, they have 36 trigger points. They've been diagnosed with fibromyalgia or who knows what. There's all these diagnoses and stuff when it's just really trigger points.
It's just a
So
overpopulation of trigger points in the body.
yeah. I mean, okay. Look, if you have one bad trigger point, it's nagging. Can you imagine having 36? Those people are effed. They are trash. They're in pain management clinics. They're seeing chiropractors over and over. They're doing all this stuff. They're miserable. They get all these diagnoses, sciatica, you name it. Now those other diagnoses are real, but what people don't know, about half of them, maybe, or 40% of them are just trigger points. But somebody will come in, they'll have 36 trigger points. I'll work on it. They'll get up off the table. They'll go, I don't feel pain anymore. I said, you got to come back in a couple days because these will start coming back. So they come back the second time. They go, well, I'm better now. I'm not an 8/10. I'm only like a 7/10. And I work on it again. And instead of having 36 trigger points, they have like 30. Okay. The next time they come in, they got 20. The next time they come in, they've got 8. The next time they come in, they have 2. And then they say, well, I don't hurt anymore. And I say, well, come in again. I find like 3. And it kind of goes like that. They'll, start out with 30. And after usually 4 treatments, there's dramatic. When they come in for the 5th session, it's dramatic. They're fine. Some people have a real pathology, a bone-on-bone situation that has created a lot of muscle tension and trigger points. So, for instance, somebody might have 7/10 pain. I work on them. They have 3/10 pain. But it will not get better than the 3/10 because they have a real pathology, a real, like, I like, that's a good example, a bone on bone. There's no manual therapy around that is going to fix that. Okay, what I mean? So it all depends. But what I've discovered with this, because you can eliminate trigger points so fast and so easily, that a lot of pain issues that have failed other therapies or that have gotten another name like sciatica, it's really because they got 20 trigger points in the low back all the way down the leg and into the calf. It's not real sciatica. Do you know what I mean? So
Gordon, I'm going to ask you if it's okay, just if you shift your camera slightly, because I'm losing you. Yeah, that's perfect. That's perfect. Yeah.
Oh, I can shift my body too.
Yeah, so. Body's better, not to interfere with the camera.
Okay.
That's good.
All
yeah,
right.
yeah. So things like sciatica, you've helped people from your perspective, and you've helped people, recover from.
Yeah, I mean, there's real sciatica and there's what I call fake sciatica, which, I mean, they have a quadratus lumborum trigger point. They got a couple of trigger points in the paraspinals in the low back. They got trigger points in the sacrum. They got trigger points on the lateral thigh. They got trigger points, in the hamstrings. They got trigger points behind the knee. They got trigger points on the calf. Shoot, that's pain down the leg, and then anybody over 40 or probably 30, they do an imaging thing and it shows compressed discs and all that kind of stuff. So they get diagnosed with sciatica and then they go to physical therapy. And if you have a real neurologic pain or a disc problem, it's good to strengthen the muscles around the areas of legs. So they have them exercising and working out. And dude, if you got like trigger points, the worst frickin' thing to do is to exercise them. It's like, because it's remember I told you, it's a damaged, cellular damage in the muscle tissue. It's like a crack on your lip. You go to somebody and they tell you to exercise your lips. It's just going to stay cracked, and that's what happens. These people, so they suffer horrible pain. It's as bad as any kind of nerve or neurological pain. When you have like a dozen or more active trigger points, it's horrible pain. It's debilitating. You can't even move. So this therapy catches those people that have fallen through, the pain network or whatever,
Yeah.
and it catches them. And it's amazing, and it is instant. People don't believe me, but you can go on YouTube, you can look up balance method uh, acupuncture, and you can see acupuncturists that are not doing the TCM stuff that they learned in school. They're doing the balance method I Ching acupuncture, and they're eliminating pain immediately right on these people. I'm doing the same thing, you know. I just
It
re-engineered it to a hands-on method,
is
and it's
the
very, very effective.
so you refer to yourself as a matrix therapist or
Well,
matrix practitioner.
I call it the, okay, I was calling it holographic acupressure, which to me is more appropriate. But then, see, I got certified. What is it? Certified or credentialed to teach chiropractors, massage therapists, athletic trainers, physical therapists, occupational therapists, and give them continuing education credits in every state in the United States. I had a web page. Nobody signed up for it. I get people going, well, I want to see a study. I I want to see a study. So, that's a lot of money to keep that thing going. Every year you got to renew all these licenses and all this stuff. So, you know, it's there's just and I was I've even contacted, I won't even say names, but I've contacted people considered to be leaders
Yeah.
in the myofascial trigger point field, and they've told me not to bother them with my nonsense. So my goal is to train 100 people, good, competent people, how to do this. As soon as that happens, all their shit's obsolete, man. All the stuff they're saying is just going to go away because there is no reason to treat a trigger point any other way than this.
So
There just isn't.
yeah. So
There's no
so
reason. That shit's going to go obsolete.
so people do comment positively as well
Oh, they
on
do.
some of your
They
work,
do.
and you do have a following
Right.
of people that are kind of using and practicing what
Yeah.
you preach. And you mentioned to me like maybe
There,
some.
there's
Yeah.
maybe like 5 people. There's not a whole bunch of people. There's not a whole bunch of people. It's like, I don't know, people don't want to change or they're afraid to, and it's pretty disruptive of incomes. What I'm thinking about, I talk to these leaders because they're teaching seminars. You go to like a seminar, it's $500 for the shoulder, you know, the next one's $500 for the low back, next to lower extremities, another $500. The chest, another $500. The abdominal area, another five. There's all this money involved in it, and it's very complicated. It's overwhelmingly complicated to me. You have to, you have to know each individual muscle, where they connect, and all this kind of stuff. You don't have to know the name of a muscle. You don't have to know, like, right here, that is the kidney muscle, kidney meridian. Right here is the stomach. Right here is the lung. There's 12. I have to know 12 muscles. That's what I have to know. It's
Yeah.
easy.
Yeah. Or
It's
chains
easy.
chains of muscles.
Yeah, they're muscle chains, but I look at them as one muscle. They function as one muscle. Just like I said, if I'm standing here and I bend
Yeah.
forward like this, the front chains are contracting, the back ones are relaxing. So it's the interaction of these muscle chains control all movement of the body. That's how I look at it. So if one muscle chain has a trigger point in it, it hurts I know what muscle chains to stimulate in order to make this muscle chain completely relax and take the trigger point out with it. And the other thing, people, okay, we're talking about trigger point is like real damage, cellular damage. So I'm teaching this one person, a physical therapist. She goes, please just tell me how to do. I got this person with a tennis elbow. Tell me what to do. She wouldn't pay $100 to join my LinkedIn group to learn, even though they pay thousands of dollars for the continuing education stuff. So she begged me to teach her. So I said, okay, do this, do this, do this. So she texts me or emails me and says, I did what you said and the pain immediately went away. I said, great. But she goes, but it didn't hold. It doesn't hold. Your treatments don't hold. I go, well, like what do you mean doesn't hold? So she's got a baseball player who's got a sore arm. She did the treatment that I told her to do, and then it went away immediately to his surprise and her surprise. Then she had him throw like a baseball right afterwards. And she said it came back. Well, yeah, because there's no spontaneous healing where everything's like miraculously healed. All you did was relax the muscle tissue in the area. So now it can heal. You have to let it heal. You know what I mean? You have to let it a few days or a week for the tissue to heal, you know? So it's like even these people that should know better don't get things, So they say, well,
Yeah.
it doesn't work. It comes back.
So,
And like I said,
yeah. What's the relationship there then with the pain? Because even that baseball example, so you want to give, after the pain, you made the pain go away, then
right.
then you want to allow time for healing. But if you're okay with the pain, if you as a person, if you're okay with that trigger point pain, are you then equal to someone that has gone through your treatment and is also in the healing place? Like the baseball player, if he, without the
Yeah.
pain, he still has to rest and allow for that place to heal.
Right.
With the pain, is he in the same spot in terms of healing?
I don't quite understand your question. If the tissue is still damaged, just the muscle is completely relaxed and gone to its natural resting state
And is
after
it,
this
and
treatment.
so is the
So now
muscle in a
the
better placement for healing? Is it in a better place to
oh
heal
oh yes
now that,
oh yes yeah,
so
all the
the,
tissue. See, the trigger point, you can look at it like this within. And now when
I
I
think you
do
have to
that treatment,
raise your hands a little
it's
bit to the
open
camera.
up. Oh, I'm sorry.
Yeah.
The trigger point is like this. And then once it's released, it's like this. Now the cellular damage is still there, but now the capillary flow, the blood flow and everything can go in there and start healing the damaged tissue and remove the calcium myosin mixture out of the area so it can heal.
Yeah. So that was my question to
Now,
you. So the pain
yeah,
itself in the trigger point in there that's not released is
well, the
inhibiting.
pain is going to be gone.
But no, but
The,
before going the treatment and still having the pain and the trigger point, the pain itself and the trigger point itself is inhibiting ultimate or ideal levels of healing within the body.
I'm not sure. I'm not sure what. I don't understand your
No,
question.
because okay, I have a trigger point on my
Okay, all right.
upper back area that's been playing
Okay,
games with me for a few days, and it's been annoying me.
okay, all
And
right,
I have been using a tool to try and get back there, or
okay,
a lacrosse ball to do my own self care.
right, okay.
So my question is, if I am okay with the pain, I want to understand: am I inhibiting my healing process by being okay with the pain? Will it heal itself just as well
Oh,
if I don't
no.
touch it?
No, it'll stay. They can stay forever. I've had people that, well, I don't even, every. Okay, first of all, there's no absolutes in
Yes.
anything
And
with body work, but
I'm
it
not
just
taking anything you're
in,
saying as an
yeah,
absolute. I understand. Yeah.
yeah, in general, trigger points stay forever. I've had people that over a decade of pain. 20 years of pain, the trigger points.
And by by
You know,
by
and
by
they
having
just
and by having a trigger point in one of these muscle meridians, um,
right.
are you more likely to form additional trigger points on the same
Oh
muscle
yeah.
meridians,
Yeah, same muscle meridian, other meridians all over. One trigger point begets another one, you know.
even on
What?
different meridians?
Yeah, oh yeah, all over the body. They'll start because it changes the way you move, you know, the way you carry yourself. And so that causes stress and strain on different muscles, and they begin having trigger points. And then and trigger points that have pain patterns and stuff like that, and it affects the entire body. It's
Yeah,
like, yeah, it affects the entire body. But the trigger point therapy that I'm talking about with the matrix, I call it the matrix, is let me just tell you how different it is. Okay. I get hired by this anesthesiologist. That's a whole story too. But I'm sitting in I got a room, I got my table, I'm sitting in my room and I'm on the computer. These medical clinics are serious places. I mean, I was a spa massage there, worked with chiropractors. So everything is documented, everything is recorded, everybody's like got PhDs or they're going to medical, the nurse, everything is like serious. I was taken back how serious it was. And I'm in this clinic and I hear people, it's a pain clinic, you know, and it's not like my back hurts. And these people are crying. They're in massive pain. It's a pain management clinic. So I'm kind of overwhelmed. I'm sitting in my room. I'm studying some HIPAA test thing on blood-borne pathogens or some kind of thing I got to pass. So I get a text from the doctor. Dr. Lou wants me in room 702 or something like that. So I go in there, and there's a woman on the table, on the treatment table. She's surrounded. There's the anesthesiologist. There's the physician assistant. There's a registered nurse, and there's a scribe. There's a person. Your image is blurry. Is mine clear?
yeah, it's clear. It's clear. It'll fix
Oh,
itself.
okay.
Also,
All
don't
right.
worry about
So
it. Yeah.
okay. So and sh and this woman is on this table and she's in a fetal position and she is crying, like moaning, like somebody stabbed her, you know, and just shaking like that. And the anesthesiologist looks at me and goes, Gordon, do you know how to, like, serious, do you know how to release the levator ani? And I'm sitting there and this is like way beyond like spa or chiropractic thing, you know. And I'm talking about trigger points. I'm a trigger point. I consider myself a trigger point expert, you know. So I go, and then he explains to me that she's got anal fissures, if you can imagine, like chapped lips or something, except it's in that area of the body. It's
Yep.
horrible, painful. And my answer was, I don't know, but we'll find out because I know that area is on the kidney meridian. So she's shaking. She's fully clothed. You know, she's got socks on. So I touched her ankles in specific areas that relax the kidney meridian. And just like that, that 9/10 pain went to 2/. She just went like, oh. That's how powerful this therapy is. There is nothing like it.
Yeah. And
That's
I
how powerful this
and
therapy
so
is.
it's almost
It
like,
is,
and
it's,
the problem is if you had something, as you said, like that
and I
on
didn't
camera.
even touch that area.
Yeah. When you have something like that on camera, then it just looks too good to be true. It
Right,
looks
right,
fake. You do,
right.
however, thinking on YouTube, on social media, you do see ones very similar to what you're describing, but administered on animals. And on animals, it no, but I'm saying it from the perspective of
Oh,
positively
yeah,
from what
okay.
you're, because on an animal it's very
Oh, yeah,
difficult
right.
to set up an actor or have
Oh,
it
yeah,
fake,
right, right,
and you can see an animal
right,
that's in pain, a
right,
horse or a dog, or
right,
or a cat, and you can see
right.
just as you mentioned now with that patient, the sigh of relief. We don't
Yeah,
know if we took it from a 7 to a 2 or from a 6 to a 5, but you
right.
just you see the organic relief of the practitioner simply really like delicately touching them on certain, I'm assuming, areas of meridians on those relevant animals.
Well, I could, if I knew the meridian structure of animals, you could do the same thing.
Yeah, you've never
I
treated or
mean,
never worked on animals?
no,
Yeah,
never,
yeah,
you
but
know.
there's an abundance of them around you, huh? And I also wanted to mention that I would have
Yeah,
loved
but
having doing this interview, by the way, in person, and maybe like showing some examples, because I do have a
hmm
couple areas of me that I would love
oh yeah,
with a light switch, at least get rid of the pain, um,
yeah.
and do it objectively as well. But
No,
you,
it's easy, you know.
yeah,
Yeah, I mean, I
you,
do it all the time.
yeah,
I've done it in bars. I've done it in bars. I do it all. Yeah, I've done it.
you
If
wrote
I
a,
just see somebody,
yeah, you wrote a story about a lady with a lower back thing in a bar.
oh yeah, yeah, that was interesting. I'm having a drink. You know, I was feeling pretty good. It was like a margarita. I'm feeling pretty good. And she's talking about her back hurts, and she's talking about how great her chiropractor is and all this kind of stuff, you know. And I just told her, I said, I could probably fix that right now in just a few seconds. Like, and she looked at me, and everybody was laughing around the bar like that. So just whatever, you know. So I went back to my drink, and the guy next to me goes, "You're serious, weren't you, about helping her?" And I said, "Yeah." I said, I don't know for sure, but pretty much I can guess. I can tell by the way she acts that she's not suffering from neurological pain. You know, I mean, like real nerve pain. Everybody gets diagnosed with nerve pain regardless. And when it usually isn't, you know, I mean, 8 times out of 10, it's trigger points. That's the other thing. So anyway, so I'm very confidently say that I can help everybody because I'm
Yeah,
only wrong 2 out of 10 times. Good odds. So why don't you just show these people, you know, that you can do this? So I said, excuse me, ma'am, you know, I'm a massage therapist. I work with an anesthesiologist. I do this. Can I touch you where you're sore? And she shows me like that. And I think I touched her other hand like that, and I said, "Do you feel it now?" And just disappeared right away. Just disappeared immediately. She was raving about. She ended up buying my drink for me, which was cool. And then she emailed me the next day saying she couldn't believe it. You know, that she still feels good and all that kind of stuff. Now, really, she needs a follow up because it would come back, and once I release it 2 or 3 times, and that's just it. It will be healed. You know. And the old way they do the trigger points, they'd be digging and pressing on those areas, right? Now it's damaged tissue, so that causes a lot of other damaged tissue. So they recommend a lot of stretching and all that kind of stuff afterwards. But that kind of therapy, you have to do that. But with this, once that trigger point goes away. You don't mess with it anymore. You don't test it. You don't stretch it. You just leave it. You just do whatever you have to do during the day to survive. But you don't exercise or test it, and you come back for follow-up treatments because the trigger point will probably come back. I expect it to come back, but then you release it again. Once you release it 3 or 4 times, then it's gone forever. Usually,
where
most of the time.
where has your, you started, you mentioned a bit about your journey 35 years ago in Hawaii,
Yeah,
with shiatsu. Um,
right.
how has, over time, how is your approach now? Because you're talking about these things in a very specific way. How has your approach really, evolved and changed over the last couple of decades? Like, have you, if we had this same conversation 20 years ago, would you be saying these things in the same way?
No, probably not.
So, and also I want to go, because I think that's an important thing to talk about as well, because
But
if trigger point therapists out there are maybe approaching things in a certain way, and they've been practicing for 5, 10, 15 years, that they're also on their own journeys of discovery,
right.
just like you
But
are and were. Yeah.
Oh, well, yeah. I mean, you always get better at what you do. I mean, if you're normal, I mean, if you know, you always, I'm 70 years old now. I'm very confident with what I do, which but that also helps the trigger points go away too. When somebody comes to me hurting, and I'm really, I know I can help a lot of people. I know I can eliminate trigger points. That confidence comes through too. And there is placebo effect in everything, in every kind of healthcare practice. I'm very confident with like
Isn't
eliminating pain.
you know is but isn't
Very confident,
is
and,
placebo
and that
is
helps.
is placebo to some degree a a crazy magic force that we
I
try?
and that's real. I think it's real. I mean, I always it's probably somebody come. Realistically, when somebody comes to me hurting, I don't know if I can help them or not. You don't. But I know I can make trigger points go away, and I know that 50% of the time, if not more, it's just trigger points. And I know that trigger points are involved in about 90% of all pain. So I know I'm pretty sure I'm going to have a positive effect, on people. So I feel very confident if they're hurting. And the thing that I like is that I know pretty much right away, within a few seconds or a few minutes, if I'm going to be effective on somebody or not. There's no wasting people's money coming back and forth. Like the doctors would send me, they'd get a new patient that's hurting, and they're behind schedule or something. They go, Gordon, go in there and check this person out for myofascial pain. That's what they called it. They said, check them out for myofascial, because they got like the myofascial pain or they've got neurologic pain.
Yeah.
There's different subdivisions of that, but I mean, they got nerve pain or muscle pain. So I'll go in there, I'll check the person out, and I'll come out and I'll go, it's not trigger points, it's not myofascial, and they'll go like this. Now they don't believe, they take into account what I say. They don't follow what I say. They take into account with all their other information that they have. But when I come out and say it's myofascial, they just they nod like that. They'll go talk to the person and then they'll send them to me. And weirdly enough, in that clinic, you would think that nobody would get far enough to be in a clinic like that when it's just a few trigger points.
Yeah. So, but
But they do.
so if you can try and take us 20 years back into the way you were thinking about these things, was it much different than way? Were you on the journey to
Oh,
be to where you are now, you think? Or were you experimenting with different things that
oh,
kind of pushed you in one direction?
well, I was always into trigger points from the very, very beginning. From the very, very beginning. Because even before I was a massage therapist, I was into martial arts and running 10Ks and doing that kind of stuff. And my buddies and I, we'd massage each other. We had these electrical massagers, and we'd go, and we hit the sore spots, and we'd really dig on them. We're laying on these rollers and massage balls, and self-massaging ourselves. So I was into trigger points from the beginning.
Yeah.
And then whenever it came out, Travell's book, Myofascial Pain and Dysfunction, Trigger Point Manual, what it was called, Myofascial Pain and Dysfunction, the Trigger Point Manual, something like that. It came out. I got that book, and it was easy to read. It was a medical book. It was very actually easy to read for anybody. And I read that book 5 times. And even in there, it explains exactly what a trigger point is, a damaged sarcoplasmic reticulum, but nobody knows that. I read right in her book. So I knew it was damaged tissue on a cellular level. So I was always into trigger point work, but I was always pressing and digging like everybody else, until about 2010. And I got licensed in 1986. And I was working on trigger points before I even knew they were trigger points in 1984. So it wasn't until 2010 that I started seeing the meridians differently and working on them and going, yeah, for about 2010. But I'd always been focusing on trigger points.
Yeah, but anything in
Uh,
2010 that kind of really stirred you?
yeah, the book Acupuncture 1, 2, 3 by Dr. Richard Tan.
All
I
right.
don't
So
think it's in print anymore, but yeah, then it's talking about balance method acupuncture. Now so it's an acupuncture book, but and I read Tom Myers' book too, but I didn't think too much. I mean, I read it, it was fascinating, the illustrations and everything. But then, so I'd read that, I'd read Travell's books, and then I saw this acupuncture 1, 2, 3. And then, when how I study is I get a book. I used to like read a book and then try to remember everything. I get to the next page and I forgot what I read. So obviously that doesn't work for me. So what I do is I read the book and I don't worry about remembering anything. I just read it. Then I read it again. Then I read it again and I don't worry about remembering anything. The fifth time I read that, I know what's coming next. And that's how I remember things. So I remember Travell's books. I remember Tom Myers' books, Myofascial Chains, and I remember Acupuncture 1, 2, 3. And they're all talking about the same thing. They talk about pain, right? That's what they have in common.
yeah,
Myofascial chains, meridians, and I'm looking, they're in the same place as his myofascial chains, right? So, and then I get an ancient text that's interpreted, differently, and it says the meridian system was discovered through dissection. Tom Myers discovered the myofascial chains through dissection. We're not talking about metaphysical qi chi woodwind fire stuff, in the telephone game, everything's distorted, you know.
yeah,
I mean,
yeah.
they'll explain a relationship between meridians in some weird, the fire's burning in the lower burner, and this is why it's connected to the lung meridian and stuff, you know. But
How's it been for you?
it,
Like so when did you start being, I would say, more public about, these things on is LinkedIn your main, like, source where you
oh no, it
or
was way before. No, way before. Uh, there's another. There was massageprofessionals.com or something. It was a website where you could go kind of like LinkedIn, except just for massage therapists. I,
okay.
and it was run by there's two big massage organizations in the United States, the AMT, American Massage Therapy Association. Then there's the other one, I forget what it's called. But that was their website. I don't know if it's still going. Yeah, so I'm typing on there, and people are trashing me and telling me I'm full of it. And, you know,
How's that been for you
yeah. So
then? So how's that been for you? Like, yeah, just being public about those things and receiving dismissive feedback, generally speaking.
oh, I've been receiving that negative stuff for, well, since 2010. I started, I don't know, maybe since like 2011. I've been receiving a lot of negative things. I mean, I just a couple of days ago, I got, you know, I got
Yeah.
a negative email.
Are you
So I mean,
are you used to it at this point?
but well, I'm used to it. But what the thing that it really bothered me, because I don't lie. I might be wrong on how I describe how the thing works, but it works.
Do you
I don't like. So what saved me was these doctors hiring me. That's what saved me. I said, okay, I have smart, intelligent people that actually know the truth. There's people here in Anchorage that know the truth, that are highly educated, highly paid medical doctors that know that what I do is real. I'm in contact with them every month on the phone for one reason or another. They'll have me come in and check their patients out. So I feel I don't like to mention their names on the online because I don't want them to be attacked. I don't want
Yeah.
to draw. They're busy, serious people, and so I would like to use their names, but I don't. There's
Yeah.
crazy people online, and I don't want them to. I don't want to be bothering them,
Do
because
you
they don't need to defend. But I feel good now. I feel good because they know, because I'll be working with them probably at the end
do,
of the summer. I'm going to go back and work part time. So.
do you continuously question yourself though as well? Like always looking still to evolve and see where you might be wrong and correct, fine tune your
Well,
practice?
I'm not wrong, but I always look for better ways to do things. Like, I let's just look for better ways to utilize what I know. But there's meridian relationships, muscle
Yeah.
relationships that are basically unknown, for all practical purposes, unknown. And I know those relationships, and anybody can do them. It's kind of like it's like algebra. I have a hard time doing algebra. I think I was getting A's in every college class I had, except college algebra. I got like C barely by like 1 point. Otherwise, it
Yeah.
would have been a D. And I talked to my son, who's real good with math. He goes, "It's just formulas. It's just you just put in the right formula." I go, "All right. Well, this is just formulas too." They heard here. There's a certain It's mechanical. I can go here, 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 here to make that go away. It's mechanical. One chain gets tight, other chains get loose. But it is so simple. But you have to understand the meridian system, and you have to acknowledge that trigger points are real structural damage. I get people telling me that trigger points don't exist. So if you think trigger points don't exist, then any kind of trigger point therapy is not going to work. Those people are like flat earthers or something. I don't know.
Yeah.
They just go by studies. Like if there's some stupid study where
Yeah.
these people,
So yeah.
they run clinics, dude. They run clinics, and half the people in their clinics don't even need to be in their clinics. Because I see them. I worked in a spa here in Anchorage, and I'm just a spa therapist. And these people would come in, and I ask them, "Do you have any aches and pains and problem areas?" And they go, "Well, I'm getting treated for like sciatica. I'm getting deal for this and getting and." So they're coming in the spa to relax, to get scrubbed and washed and get and I go, well, would you like me to, you know, see if I can take your pain away? And a lot of them they would get upset because already seeing professional deals, chiropractors and physical therapy. I'm under doctor's care. I'm here to relax. So I'd work on them and I'm thinking this person is suffering for nothing, you know. They're suffering for nothing. So it was like very frustrating. I actually got in trouble because I would actually try to talk some of these people into letting me work on them, and then they would complain to the spa owners that I'm taking their spa time away with me trying to, I get yelled at by the spa owners, and I was like miserable near the end of my spa career.
Yeah.
And I had a medical doctor that was a regular client of mine, customer. He'd come in every month for a massage. There was nothing wrong with him, no pain in his body whatsoever. I'm just massaging him. And so I told him one day, I said, look, you don't know this, but I have this like method of eliminating pain immediately in people. And I said, you don't know it because you never have any pain, mysteriously. And he's looking at me, and I showed him some videos. And the guy's an anesthesiologist. He's looking at it. And I said, can you tell some of your friends to check me out like that? And he goes, all right. So about 2 weeks later, I get a call from an anesthesiologist. Are you Gordon Wallis? And I go, yeah. And he goes, can you come in and tell us what you do? So, and that was like early in the morning, like 7 o'clock. Now I'm sleeping because in this spa, I worked on kind of like a swing shift. from like 1 in the afternoon till like 6 or something like that. So I would stay up till 3 in the morning watching infomercials and all this. I'd wake up at like noon, brush my teeth and go in. So I'm like just exhausted, so, but this medical doctor's called me. So I come in and I get to his like, clinic, and I go in this room, and it's this giant, long table with look like about 20 people at the table. Just like entire staff, like nurses, two other doctors, and they're all like serious. Like I'm sitting there, and he goes, "Okay, would you like to tell us what you do?" And I go, and so I tell him what I do. I eliminate trigger points immediately. I discovered this method and stuff like that. And then they ask me some questions, and then he goes, "Okay, we'd like to see a demonstration." And I hear some people chuckling because I know I'm on the spot, right? And I am on the spot. I'm nervous as hell. So I go into this room, and they're all sitting around. There's a treatment room table, and this person comes in and lays on the table, and he goes, "She's got trigger points. She's got a cervical deal wrong with her. She's got all this stuff. We want to see what you do." So all right. So I explained to her, "You tell me if or when I get to a tender area, a bad spot." And I always describe it. If I press here and it hurts, that's a bad spot. If I press here and it hurts anywhere else, even if it doesn't hurt here, if it causes your big toe to hurt, that's still a bad spot. I want you to tell me. Okay. So I find one on her hip right there. I touch her. I can't remember what I touch her hand or do my thing. And I said, "You feel it now?" She goes, "No," like that. Everybody stands up. All of a sudden, they stand up. They're looking at me. I went through about 15 trigger points, one after the other, just
Knocking
like
them
that,
down.
eliminating.
Yeah.
Yeah, knocking them down, just one after the other. So they're all looking, and one doctor's, "I've never seen anything like it." She was a guest doctor who was into alternative medicine and stuff, and been to different clinics, and she said, "I've never seen anything like this in my life before," like that. So the anesthesiologist owns the clinic goes, "What do you think of the big mistake of it?" He goes, "What do you think of like trigger point injections?" I said, "That shit's all obsolete." He goes, "Of course, that's what we do." But he started laughing. But and then afterwards, after this demonstration, it went perfect. He goes, "Thank you very much for showing us what you do." He shakes my hand, and then they all left. Everybody just left, and I'm standing there. I'm going like, shit. They didn't hire me after this? This is like, I did some phenomenal work right in front of them. They didn't hire me. So I go home. I'm kind of sad. I'm going like, wow, man, what do they want? I mean, so the next morning, the phone rings again. And "Gordon, I have a patient I want you to see." And I'm thinking, oh shit, they're still testing me. So I go into the clinic, and he introduces me to this young lady. It was so she's Filipino, a young Filipino woman, and she's like shaking, and her neck hurts. She can't turn her neck. I mean, and I'm looking at her, and I'm going, wow, man, this lady is really jacked up in pain. If this is the test, they're not gonna hire me because I'm thinking in my head, there's no way I can help this woman. I mean, you see just sitting like crying, tears, crying like. So then I sign all these paperwork, like if I kill the patient, they're not responsible and all this kind of stuff. I sign all this legal stuff. So I'm like really nervous. I'm signing this deal. So we go into the room. They bring a nurse in because it's a young woman. So they have a nurse in the room with me. And I'm thinking, God, there is just no frickin' way I'm going to be able to help this person, but she's hurting. I got to try. So I started finding trigger points. I started eliminating trigger points in her back, all the way. And he came back in about 45 minutes later. She's sitting on the table, smiling. And she goes, "Dr. Lou, I can turn my head and it doesn't hurt anymore," like that. And he looks at me and he goes, "Come with me." And he took me into his room. He says, "I don't know what you're doing." He said, "You have talent." He says, "I need you for my patients." And he hired me. So, and I started working there. I mean, that's how good this is. This is not, you know, eliminating 4 or 5 trigger points on somebody. This is like eliminating multiple trigger points at once, whatever is underneath my palm. This is eliminating trigger points without even touching them. This is eliminating trigger points instantly. Now that they'll come back, you have to treat these people again, but each time they come back, there's less and less and less and less until there isn't any.
And less likely, you're saying,
And
to develop elsewhere on the chain or on other
well,
chains.
you check I end up eventually, usually, checking the entire body, because if you leave a trigger point anywhere on the body,
Yeah.
it can cause a trigger point, the chain reaction, eventually to come back in time.
Yeah. So if Gordon, to kind of end this and summarize, for trigger point therapists out there who, again, do acknowledge that there is such a thing as trigger points, what would
Right.
what would be a piece of advice to them? People that are maybe early on the journey, or maybe even a bit more seasoned in the journey, but are still on the journey of fine-tuning their practice and learning about trigger point therapy.
Well, I'm also in negotiations right now to be teaching in a massage school. Okay.
In
So
Anchorage?
when that happens, all the training is going to go through them. You know what I mean? And it's going to cost a certain amount of money to get that training, however we're going to do it. I'm still in early negotiation. So if that happens, that's going to be the way to learn it. Okay. But right now you can learn it on LinkedIn. It's more of a self-learning thing, but they have access to me on the phone. And that's the way to do it. And I'm only charging $100. I mean, I have a couple physical therapists I've charged $1,000 for in person training. So I mean, it's a real bargain. You have to be self-motivated, but that's the way they. And I even have a free course, a free mini course that people can learn that contains 3 different systems that are pretty much powerful. That'll pretty much eliminate any trigger point.
Also, where can one find that?
On LinkedIn, they just have to contact me on LinkedIn.
Okay.
And then they can get started. But you have to try it. You have to, people write it off like right away as, they didn't learn it in school, so it can't be real.
Yeah.
I know everything. I've
Are
studied trigger points.
there any contraindications to at least trying?
Oh, there's no contraindications at all with this, because the worst thing will happen is nothing. You're not digging on damaged tissue. There's no contraindications. Like, somebody has a trigger point here, I just have to touch, or maybe I don't even have to touch. If it hurts when they swallow, I can just touch the feet of their hands. I say, now swallow.
Yeah.
Or I'll just touch right here. I'm not digging on any sensitive tissue at all. And with this, you don't have to. You can't hurt anybody. You can't make anybody worse. Like I said, the worst thing that can happen with this therapy is nothing. It's very easy. You don't have to know anatomy, physiology. What you do have to know is where the meridians lay on the body. That's probably the hardest thing. But once you have that down, and there's books, I tell people what books to get that show meridian diagrams that clearly point out the muscle structures you have to be motivated and want to learn and want to try. But a lot of people, they just think, oh, that's bullshit. This guy's crazy or whatever. And they don't even try.
Yeah. So look, yes, please.
Yeah. So it's very, very easy. It is not hard to do at all. The hardest thing is to be familiar with the meridians. And when one meridian has a trigger point, I have diagrams that tell you exactly what meridians are related.
So Gordon, I just want to say, so I appreciate you again coming on to share these things and talk about them. almost assuming that you will get some backlash and some heat. So I do appreciate that.
I
And
mean, it basically, the backlash is that there what if people realize what this can do, like I told you with the lady on the table with the anal fissures and they just touched her feet and the pain went away. That's there's no other trigger point. All other trigger point therapies are obsolete. I don't care what,
yeah,
cupping, instrument assisted stuff, digital pressure, stretching, active release, just don't need to.
is a good starting point for people to follow you on LinkedIn. See, because you do post pretty regularly, little bits of
Yeah.
content.
I even, you know what I mean? I used to kind of want to try to keep what I did kind of secret in a way. I used to, because it's so easy. I wanted to kind of cap it because it took me years to accidentally discover this stuff, and I have to pay every year $400, $500 for my continuing education, or every 2 years for my continuing education stuff. So I said I want to make some money teaching something that's like really good, But I got so much flack and so much negative stuff from it. I can even post exactly how to do it on LinkedIn, and there'll be, out of 1,000 people that can possibly see it, there'll be like one person will go, "Oh." I mean, so I'm not even afraid to tell one of my latest posts. If somebody like really looks at it, they'll figure out what I'm doing. I mean, it is so easy. What I'm doing is so simple. So
So
easy.
simplicity, and I think
LinkedIn is the best way.
yeah, and I think you
Uh,
a few times I think you posted a Da Vinci quote about simplicity
Yeah,
that you've
everything
repeated a
is
few
good.
times.
Yeah. But this podcast, I don't, I get kind of hyper and it's hard for me to explain things, but it is here it is in a nutshell. You determine what meridian the trigger point is on. All right. Then I have a diagram that shows all the other meridians that you can stimulate that will relax that trigger pointed meridian and take the trigger point out with it. And all the release areas, that's what I call them, are around the joints. The wrist, the elbow, the armpit, the knees, the ankles, and you can go between the knuckles and between the toes. That's all. And the other weird thing is, no matter where the trigger point is, you can make it go away from any joint in the body. Like, say the trigger point's here, I can make it go away from this hand. I can make it go away from this elbow. I can make it go away from this joint. I can make it go away from the same side. Wrist, hand, elbow, right? I can make it go away from the same side knee. I can make it go away from the same side ankle, or between the toes, the same side, or I can make it go opposite side. You can just pick whatever joint you want and you can eliminate that trigger point. And it all depends on where I'm at standing and what I can reach on the patient as to where I choose to stimulate.
So on that, we'll end it with that
Yeah.
nutshell explanation. And I think at the minimum, also with me personally, it's intriguing stuff that I would love to experience, and I will
It's
definitely
been
look.
around for thousands of years.
Which
You
is
can do another interview if you want, where I can actually teach a basic system.
that'd be great.
I'll just teach it if you want, like a basic system.
Yeah, that'd be great. I think there's a lot of points, no pun intended, that you
Yeah.
bring up in your posts that are also worth just thinking about when approaching the human body and what it is all about. Period.
Right.
So thank you, really, thank you for being out there, and thank you for
Yeah.
taking some heat and for expressing yourself and expressing your knowledge and your experience, which I think is always valuable and always helpful. At least if it, if it helps someone think twice about something or dig deeper into something.
I mean, yeah, there's no clinical studies on it, like I said, but there is balance method acupuncture, there's I Ching acupuncture, there's tongue acupuncture. Those guys, and I've studied their stuff, they don't know what I'm doing either. They don't, and they're talking in acupuncture terms. I'm talking in my own terms that I make up, but it's based on the same information that they're using. And there's tons of books on what they're doing, because I've gone through all the trouble to retranslate, transpose, and put it into a hands-on trigger point thing. They're not necessarily looking for trigger points, but I'm using the same information. So there's that stuff too. You can see, I mean, the dry needlers, I mean, if they saw what these guys were doing with needles, disruptive technology is all I'm saying.
Awesome, Gordon. Thank you so much.
Okay.
I appreciate your time. Thank you very much, and I do hope we can do a part 2 and get some extra information.
Yeah, because I think I jumped around. It's hard for me to explain.
Yeah, but I think it's it'll get anyone who's have watched so far will definitely have you've stimulated something.
Yeah, but the LinkedIn posts are and okay, I'm 70 years old. I'm not coming to broadcast to the world some kind of scam deal. And there are anesthesiologists here that know me and that I work with. So, I mean, when I say that, then they go, well, they're in on the scam too. I'm not these people, man. These are serious people at Alaska Regional Hospital. They don't need to con people for patients. They're overwhelmed with patients, So anyway.
All right. Well, I really appreciate it. Thank you very, very much. And we'll do this again. We will. I'll be in touch with you off air.
Yeah, and put a young guy's head on my thing.
We said the next time.
I keep saying this is horrible, man.
With AI, we'll figure it out with AI. I think you've been playing. You've been playing with the AI.
Give me an avatar, man.
Yeah.
Yeah, give me an avatar of some kind of. Anyway, but nice talking to you. I hope this intrigues some people. But like I said, they come on LinkedIn, they contact me, they can talk to me on the phone.
Awesome.
Anybody.
Well, thank you. Thank you, Gordon.
You're all right.
Have a great weekend. Welcome. Until the next time. Bye-bye.
You too. Bye-bye.